Good evening, everyone, and welcome to this WBUR Virtual Town Hall. I'm Tiziana Dearing, host of WBUR's afternoon program, Radio Boston, available on air on 90.9, online at WBUR.org, on your smart speaker, or as a podcast. Thank you all for joining us for our discussion on what a post-pandemic society here in Boston might look like. It is the last in a series of town halls we have hosted on important subjects. You can subscribe to the WBUR YouTube channel to get notified any time we release a new video. You can also click the bell icon right next to the subscription button if you want to be notified whenever WBUR goes live. Tonight, we want to ask some important questions about what comes next for Boston and for our country. What will this city look like after phase 4? After a pandemic? What will change for higher education and Boston's art institutions? And how will the city grapple with its long history of racism, its systemic issues going as far back as the founding, but also present and visible today? It is all on the table tonight, and we welcome you to participate. Think of this as our kitchen table where you can pull up a chair by submitting questions at slido.com using the event code WBUR VTH12. That's WBUR VTH Virtual Town Hall 12. You can also go to the YouTube live chat to talk to others who are watching and exchange ideas. I'd like to introduce you now to our 4 panelists who are here to reflect with us and to help us have this conversation tonight. All are leaders in their fields, representing a broad range of subjects and institutions that have been deeply affected by this pandemic. All join us via Skype, and in keeping with our kitchen table feel, all have welcomed me to call them by their first names tonight. We have Lynn Perry Wooten, who tomorrow officially becomes the next president of Simmons University and the first Black president. Lynn, welcome to WBUR's Virtual Town Hall.
Thank you for the welcome.
I want to call everything Radio Boston, so I'll try not to do that again tonight. Matthew Teitelbaum is the Anne and Graham Gund Director of the Museum of Fine Arts Boston. Welcome, Matthew.
Nice to see you.
Dr. Helen Boucher is Chief of Geographic Medicine and Infectious Diseases at Tufts Medical Center. Helen, good to have you.
Thanks for having me, Tiziana. Nice to be here.
And Ricardo Arroyo, Boston City Councilor from District 5. Welcome to you as well, Ricardo.
Thank you very much for having me. Excited for the discussion.
And again, for everyone, the purpose of these town halls is to highlight an issue and invite a discussion between our panelists and with our audience. So again, you can give in questions at slido.com with the event code WBUR VTH12. WBUR VTH12. So our focus tonight is on imagining a post-pandemic world, but it feels like we can't really do that until we take a minute to recognize the world that we are in now. So Helen, I have 2 charts. I'm going to put them up at one at a time for you, for the panelists, for the audience, and then I'm going to invite some reactions beginning with you. This first comes from the Johns Hopkins Coronavirus Resource Center. Now, it's a little bit hard to look at first, so let me tell you, folks, as you're looking at this, imagine a map of the United States. So you can see California off on the west side, you can see Florida down on the bottom right, and each of those boxes represents that state with information about number of new cases per 100,000 people from January 22nd through June 25th, 2020. So if you look at the shapes of those curves, you can see who's had a spike, who's stayed relatively flat, and who is beginning to climb now. And it tells a story about how different parts of the country have experienced the virus. So Helen, I just want to start there by asking you how important in our ability to collectively address this pandemic is it that those boxes look really different depending on what state you're in?
Yeah, so it's a great question, Tiziana. And what we have with COVID-19 is both a global and national epidemic, and then a series of local epidemics. And so I think by looking at the states, we start to get a sense of what's happening at a more local level. But of course, it's not that simple because we all travel within and between states, even in this setting, right? And so today the governor came out and said that we wouldn't have to quarantine if we went to the few local states who are performing better right now in terms of the epidemic. that doesn't mean there's no risk. And I think that we can glean things that help us by looking at this map. We can get a sense of kind of who's had their pain already and who's in for more pain, right? We know that states like Texas, Alabama, Arizona are in really tough shape right now with the virus, with cases rising, with hospitalizations and ICU beds being full. And we can get a sense of what they're in for. Here in Massachusetts, we're pretty fortunate. The numbers have come down nicely. We've endured really tough times, right? In April, especially when we had our peak. The hard part is that with all that said, we can't say that we're not in for more, right? And that's the hard part. This is a very new virus, and most people have not been exposed to it yet. So
Helen,
the risk is real.
I'll interrupt you for just a second there. As you're talking, I'm going to ask our team to bring up a second slide, which is the dashboard information about the Commonwealth. This slide was published today, June 30th. And has the dashboard information as well as today's data. I'm sorry to interrupt you, Helen, but I think it would be good for people to be able to see that information as you're talking about the Commonwealth.
Sure. No, it's great. It's great sort of contrast to some of what we saw in some of those harder hit states, right? Massachusetts numbers have been good, right? So we're in the yellow and the green in all the key indicators that the governor's looking at every day. And it's been this way for a while. So we're doing well, whether we look at the number of infected people, people in the hospital, deaths, or the percent of positive tests. So these key indicators that we're following. And that's a result of all the hard work that's been done and this very, I think, slow, deliberate opening that we're in the midst of. So it's good news, but we can't rest too assured based on that good news. We have to be vigilant and keep up this hard work if we want to get to the point where we can reopen universities and more of our businesses.
Ricardo, when you see those charts, what do you think about in terms of the public leadership story that it's telling us and the public leadership lesson it's teaching us for decisions going forward?
So I see them in two contexts. I see them in the context of those numbers, though we're trending in the right direction, the impact that we've already had with 8,000 plus deaths, with what that looks like in Black and Latino communities, and the risk that continues to pose for those communities. I see them sort of as cautionary still. From the standpoint of making daily progress, I'm deeply aware that we could just as easily end up in a situation where when we were first so when COVID-19 with Biogen, which seems so long ago, when that first happened, we went, I think within a week and a half, we were in quarantine status and everybody was in their homes. And I think that kind of doubling effect is something that we have to pay a lot of attention to as we start to reopen in a real way, because nothing fundamentally, we've got more testing capability. We have more knowledge of the disease itself. So people are wearing masks and are sort of trying to socially distance. But the disease itself hasn't fundamentally changed. It still exists. It's still there. There's no vaccine. There's no cure. And so from that standpoint, I'm cautious optimism, I would say, on where we're headed right now. I think I have concerns with reopening, perhaps at the pace we're reopening, because a second shutdown politically, fundamentally, economically would be devastating for a number of different sectors. But it's something, I think, for cautious optimism that today we reported no deaths. And so I think that's a fantastic place to be right now.
So Matthew, picking up on, I'm sorry, go ahead. What's that? So Matthew, picking up on what Ricardo was talking about, he talked about the moment when we did go into after the Biogen conference and as the cases started to kind of grow. I want to play a clip here from Governor Baker. This is March 23rd when he announced his emergency action, shutting down most businesses, operations, nonprofits, and asking residents to stay home.
First, I want to acknowledge the incredible impact this action could have on businesses and individuals. It's not lost on me or anybody else in our administration that many businesses, locally grown and owned by our neighbors and friends, are the businesses most unlikely to be able to put in place remote or telework policies. But I also know that by taking this action now, we can significantly improve our position in this fight to slow the spread of this virus. Acting now to prevent more person-to-person interaction and spreading the virus will buy us more time, so our healthcare system can better prepare for a challenge unlike any they've seen before.
So he is talking about businesses, nonprofit organizations. You run a significant institution here in the Commonwealth and in the city. And he also often, when he was talking about that decision, talked about there were only options among bad, and there were only bad choices, and you had to pick the least worst choices. How did you find yourself thinking about your institution and how it was going to weather what came next?
Well, for us and for many, one of the big challenges, we don't actually know how this is going to end. We don't actually know the indicators that we can follow to put our businesses back on track. And what I mean by that is we exist as a museum to bring people together. We exist to share information, to create new ideas by gathering people in space. That's what a museum is. And that whole notion of how people gather and how they create proximity with each other is very uncertain as we think about the reopening and the next step and all the rest. We've been challenged, but I want to say one thing that really, and maybe we can talk a bit about this, there's been such a spirit of generosity, of sharing information, of trying to come to conclusion, of communities coming together. And as a workforce, we've also learned new ways to work together. So I'm very concerned about how we move forward in this spirit of uncertainty. But my optimism comes from the fact that we have, as a workplace, learned how to work together and make decisions with much greater clarity than we did before.
So Lynn and Matthew, thank you for raising a couple of other things that we can and will talk about during our time. And again, I just want to re-anchor in the fact that we will talk about the future too, but I think it's important to anchor us in the experience we have had and are currently having. Lynn, we had the pleasure of talking to you on Radio Boston just before the pandemic about just before, about your vision and your challenges for leadership coming into Simmons. You start tomorrow. I know you were thinking about your job in February and March. How did you find yourself thinking about what was going to be different or maybe not possible or would have to massively change about your priorities when the news came down?
I've been in higher ed for 25 years. And in March, my whole mindset changed about how I had to think about delivery modes. All of a sudden, student, faculty, and staff well-being and health became my top priority. But even coupled with that, I had to ask myself in this present time, as you said, this pandemic, how do we deliver high quality education? I almost say in the Jetson-like era. And it's similar to what Matt said, like museums, the residential higher education experience is about people coming together to learn, to grow, to transform. And what keeps me up at night is, like I said, the safety, health, and well-being, but using technology as a complementer to deliver high quality experiences. And, the financial future of universities, and how do I prepare this next generation for careers for post-pandemic? Those are all the things that I'm thinking about.
Let me ask all five of you, and then after that, I'm going to go to our first participant question. So as we close this part of our discussion that was about what has happened, where are we now? Was there anything in the last couple of months where you, as a leader and as a professional in your work, in your institution, you thought, oh, this isn't going to be part of the reality anymore. This thing that I planned on doing or this priority that I had just fell by the wayside. Do you understand my question? And any one of you can feel free to jump in first.
Well, Matthew. I guess I would say that one of the things that concerns me a bit is that we are a great international museum. We have international collections, we have international relationships, we exist in the exchange of information in a truly global world. And I worry a bit that the pandemic pushes us to be more internally focused and more locally rooted. I think there are big, big positives out of that. I think our connection with community has already become deeper. But the loss of the global does concern me. That fair exchange of ideas, that of art, things are going to get a lot more challenging in how we move around the world. And we are who we are in relation to our community in part because of our global relationships. And so there's going to be, as the president says, a rethinking of what some of our commitments will be.
Let me invite the other three of you to react to that, build on that.
You know, Matt, that's an excellent point. The first time I knew the pandemic was going to be an issue was when I had to plan my study abroad programs. And as you said, in the next year or so, our students, it's going to be very challenging for them to have those global experiences. We see in the news today what the European Union is saying about America. So we see borders lifting up. Also, going back to your point, Matt, the thing that I probably mourn is I said universities are about communities, graduations, convocations, orientation. Dorm life is not going to be the same. Bringing young adults together in community and convenings to learn together and develop. And so that's the second thing I'm missing. The third thing that's coming to my attention, and this, I think this could be a positive in some ways, is that diversity, equity, and inclusion, a lot of organizations have been treating it as a sidebar, but also during the pandemic, it's becoming a top priority, this social reckoning and how we move forward, whether it be health disparities or access to education or economic development or the arts.
I'm just going to interrupt for a second. I've got a little note from our producers. One of us, for whatever reason, is producing some strong background noise. So if we could all go on mute when it's not our turn, we're just going to see if we can quiet that background noise down. It's something that often happens. Ricardo, it looked like you were going to jump in there.
Yeah, so I would say for me, I was elected, this is my first year in office. I was elected in January, and my district is 75% people of color, 40% immigrant. And a lot of the work that I was intending on doing was building pipelines to the office. In other words, often those that need our resources the most don't know how to contact us, don't have those connections, don't know the process or the systems. And a lot of my early work was building a pipeline to communities and to neighborhoods that hadn't really been engaged in that way. COVID-19 forced a lot of those things to change. So instead of being able to go and meet people at a local meeting or in a park or when they're in their neighborhoods at their doors, that all kind of went away. And so we did have to do, I think at this point, it's over 7,000 phone calls my office has done to check in on residents because we had to change the way we do that, because when we don't receive phone calls, we force those phone calls out, in other words. So we go to the source. But that's been concerning for me because it's not just my office. That means that other neighborhoods and folks who speak different languages, folks who don't really know our systems, folks who really need those lifelines right now more than they've ever needed them, are going to experience issues with, city halls by appointment only right now. When you don't have those pipelines and that you don't have access in person or community meetings or ways in which to really engage, I think there's an effect with that we're still coming to terms with what that means and how that's really impacted us. For me, that would be the one thing that really changed immediately with COVID-19 was the ways in which we intended to engage with our residents. We no longer can do it that specific way.
Helen, I'd like to use that comment from Ricardo to actually pivot to one of the questions that have come in from one of our participants. This is from Thomas, and it says, how do we begin to address mounting mental health issues when we are so physically distanced from our support systems?
Yeah, the mental health aspects of this disease are multitudinous, right? They're among our patients who had to be in the hospital without family members and visitors up until very recently. And now they can have one visitor, which is better. But the whole face of how we deliver patient-centered and family-centered care is so different. Mental health for all the healthcare workers on the front lines, many of whom are having post-traumatic stress now in the kind of as we come out of this. Mental health for our students. I have two, teenage student daughters. This whole thing has had an impact on them. I think the elements are myriad, and it comes back to something that was said earlier. It's figuring out different ways to make those connections with providers. We've had a great emotional support program running here at Tufts that has been largely virtual and continues, and some really interesting ways to reach out. And there's been guided meditation and all kinds of different outreach to us and our patients to try to help meet people where they are, along with some in-person things. But I think we're going to have to be creative to figure this out.
I'm Tiziana Dearing, and this is WBUR's Town Hall on what a post-pandemic society might look like. If you're just joining us, we are live streaming with Lynn Perry Wooten, Matthew Teitelbaum, Dr. Helen Boucher, and Ricardo Arroyo. We want you to be part of the conversation, and you can submit your questions to us by going to slido.com and using the event code WBUR VTH12. That's WBUR Virtual Town Hall 12. I really appreciate the way the four of you have engaged with me in the first part of this conversation, which was focused on where are we, what have we lost, what has changed. The second chapter in our discussion as we prepare to think about our future has to be the way the fault lines of disparity were both exposed by the virus itself and then by the protests about police brutality and racism that emerged within the context of or at the same time of those protests. I want to start shifting our gears by giving you another little video here. Earlier this month, Congresswoman Ayanna Pressley, several other prominent Massachusetts elected officials of color, they held a press conference on the steps of the State House. Many of you may have seen it. Amid the initial demonstrations over police killings and systemic racism in America, I want to watch a little bit of what Congresswoman Pressley said at that press conference.
You know, we are here having to physically distance and wear masks because we are experiencing an unprecedented pandemic, which has disproportionately hit Black and Latinx communities. And we are navigating that loss and that trauma while also navigating the layered trauma of the pandemic and the scourge that has been with us for far too long of police brutality. The pain of Black and brown folks has been delegitimized since the beginning of time. We are always having our hurt denied. We are always being talked out of our hurt.
It was part of a longer speech that the Congresswoman gave, and a number of other people that day also talked about being forced into protest during a time when we were being asked to be separate, when we were asking to social distance, but that the urgency of the moment forced people to put themselves at risk, especially Black and brown protesters who were already disproportionately being affected by the pandemic. Now, I do want to note that we've been doing testing here in the Commonwealth since then, and actually, so far at least, the data does not demonstrate that those protests have been spreading events here in the Commonwealth, which is fantastic news. I think I just want to start by asking or inviting any of the four of you to respond and reflect on what you heard from Congresswoman Ayanna Pressley.
So I'm happy to go first on that because I was there, I was present. In March, so I'm the public health chair for the Boston City Council. And a big reason why I did that was I understood innately the ways in which racism impacts every single aspect of our lives, whether that's housing, our jobs, our health, you name it, it's on there, right? The Boston Public Health Commission had listed 26 social determinants that essentially make up your health outcomes. Every single one of those they found was impacted by racism, and racism itself is actually a determinant of your health. It can increase all these negative health factors if you yourself experience racism. And so when we talk about, the 400 years of where we are, I think it's really important to understand that these systems that we operate under were put in place about 400 years ago, right? And then they haven't much changed. And they weren't built to serve us as communities of color. They weren't built to include us. In every level of inclusion or any level of aid that it provides to communities of color were hard fought by communities of color and white allies through that system. But that doesn't change the fact that those systems weren't built to serve us. And so as we deal with a pandemic, what I've struggled with deeply is most people have said, we don't want to go back to normal because normal is deeply racist. And that is true. The problem is I don't think that what's been taken into account is where we're headed is only worse right now. When we talk about economic inequity, that's growing by the day. When we talk about Black-owned or Latino-owned businesses and the aid that they did not receive from Congress and what that's meant for their ability to reopen, that impact is happening every day. When we talk about health outcomes and how disparate outcomes have happened in Black and brown communities where they've been more at risk, more likely to die, and more likely to be working in essential work, that has only grown. And so I think what I have been focused on deeply in this time, and I think Congresswoman Ayanna Pressley shares my sentiment on this, is that systemic problems require systemic cures. If we're going to deal with the symptoms of those systems, which is kind of everything that I've talked about, those systems create results, and then we usually are dealing with the results of those systems. Unless we make reforms to the systems themselves, we're not going to get to that new normal that I think most people want to get to, that normal that doesn't include these deep inequities in this racism and the racial inequities that we see. And I think the reality is that requires intentionality, and that requires resources at a clip greater than we've ever seen them before in those areas.
Lynn, I saw you nodding, and it looks like you'd like to come in there.
Yeah, Ricardo knows he was preaching to the choir, as we say. As an organizational development scholar, we have a phrase that say, every system is exquisitely designed to get the results it gets. And what Ricardo spoke to is, for 400 years, America has been designed to get the disparities, the inequities, the racism that we see. Where I sit in my sector as higher ed, I've been thinking about, is this our time, and what will change? What is change going to have to look like? I'm trying to use this crisis as an opportunity. The K-12 system is going to have to be fixed, which we didn't talk about. There's students who didn't learn anything from March till June because of access and teacher qualities. How we think about higher education and access, the pricing of higher ed, the delivery modes, the majors, and how we prepare people for careers are going to have to change. Also, where I said higher ed is a platform where research needs to be done. Research has to be a vehicle to be the systems change that Ricardo has spoke about. The final thing I think we need is in every sector, whether it be the arts or public policy or business, is that people have to come together to understand the lived experiences of racism. And higher ed, that comes through social learning, service learning projects. It comes through the classroom, the curriculum. It comes through taking the arts. In our nursing school, for example, everyone should be required to study health disparities and those social determinants that Ricardo just said. And so this is the time we need major systems change. And one of the reasons why I'm so excited is because I think Boston has the resources and the capacity to do that and be a beacon for this.
So Matthew, I want to invite you in here. The MFA has very publicly been grappling with issues of race and racism and confronting those head on over the last couple of years. The museum committed just last month $500,000 over 3 years to community engagement and diversity initiatives following allegations of a racist experience that a group of middle school students had at the museum. As you think about that, as you think about the moment, as you think about your leadership, what role can an institution like the MFA play going forward in making the city more inclusive, more equal, and more honest with itself about where we are and where we need to go?
Mute.
Matthew, we got to take you off of mute. Sorry. I made you mute before. Sorry.
I just want to say that my two sons like it when I put myself on mute, but I meant to turn it on. Museums can do only so much, but what museums must do in their communities is two things. Create a sense of belonging. The Museum of Fine Arts Boston belongs to everybody. How do we do that? And second of all, if we do our work, how do we create, challenging word, but an enlightened citizen? How do we give back to the community so that people think of the world as a bigger place? And we did have some experiences at the museum which are counter to that, where people didn't feel as though they belonged, didn't feel as though they were welcomed, didn't feel as though, like museums, when they work, make the world a bigger place, it felt smaller to them. So the question for me is, how do we create an environment in which we can give back to the community? The more we give away, the richer we are. How can we give something away to our community? And one of the things we're very focused on, apart from the training of staff, the protocols for visitors, the way in which we share our resources with students when they come, we also want to make sure that we become an institution in which the voices of our community are heard, that we are a platform in a reciprocal relationship where they can see themselves, understand themselves, and be heard, speak to others. Our collecting of art, the way in which we interpret art, the way in which we create the cohort of students and staff who greet visitors, it has to change. And it has to change because when that starts to change, belonging starts to change. And when belonging starts to change, you are part of Boston and you are changing the way Boston understands itself.
Helen, what I'd like to do is combine another question from our audience with a question that I already had in mind myself for you. So it's going to be kind of a twofer, but I know you can handle it because you've done a wonderful job in your call-ins with us over the months. The question is from Kathleen, and it's to mitigate the risks and reduce future hotspots. How can we address the problem of population density, especially at a micro level in low-income communities? So there, I've got to grab the name again. Kathleen is asking about some of the social determinants of health, as Ricardo was talking about, with density of housing, with availability of lower density housing, open green spaces, places people can go out and be socially distant and be together, combined with what we know right now about the reality that the data is telling us of how low-income families, families of color, vulnerable populations are already disproportionately being impacted by the pandemic. Can you paint that picture out for us a little bit and talk about where you see need for policy change?
Sure. So, where we see things is that people of color and people who live in low density are clearly more affected by COVID-19, as well as many other diseases. So this is a public health problem that has been seen before with other diseases that disproportionately affect this population. And here, what we seem to see is people who live in high density, people who are frontline workers and have had to come to work every day, since March, had to take public transportation, haven't had access to all the preventative measures that other people might have. Some people who live in a level of poverty where they might not even be able to afford face coverings, for example. Then I think another thing to acknowledge is that there have been issues with reaching people with things like testing and other measures. This requires a number of policy issues. It requires reaching people where they are with things like testing and other measures, making sure that the things that are available in one neighborhood are available in every neighborhood, making sure that people feel safe coming for care. And that comes back to the racism issue again. We have a situation in all the hospitals in Boston where we don't have enough Black and brown doctors. And that makes people not as comfortable coming to the doctor. And I think we all have to look in the mirror and face this. And I'm really grateful to the leaders here at Tufts and really across the country for taking this on. This is a public health issue, and the way we're going to solve it is by recruiting more people of color to medical school and to our residency programs and to our jobs and ultimately to leadership. So I think this requires policy change at the micro level, getting out into neighborhoods to offer testing and masks and all kinds of things, but also at the macro level and thinking of how we design and conduct our business as major academic teaching hospitals.
So as we were talking in the first part of our conversation, kind of about where we are right now, I asked you each, what's something that you had to give up or that was a priority that isn't now or that can't happen now that was something you were planning on? In this section of our conversation where we're talking about disparities, I think the question that I want to then ask each of you to reflect on is, what have you come to understand in the last few months absolutely must happen that maybe wasn't a piece of your focus in January or February? Ricardo.
So this was a piece of my focus, but I think the urgency changed, and I think it was drastic. Recently, a report was released that 120,000 households are at threat of losing their home or eviction. And I think when we talk about, I was a public defender before I ran for office. And so the word stabilization was said a lot. We wanted our clients to feel stabilized. And the number one thing that helped our clients stabilize, not interact with the system again, if they were on probation, it was the one thing that you could kind of link if whether or not they successfully completed that, was whether or not they had stabilized housing. And we're in a situation now where I think right now, as we speak right now, there needs to be real urgency about the fact that we have a rent in a foreclosure, a mortgage foreclosure moratorium. So there's an eviction in a foreclosure moratorium, but that doesn't erase the debt. And we live in a city where the average white household has $250,000 in net worth, and the average black household has exactly $8. When you talk about cutting folks off economically, which is what happened with this pandemic, we're looking at a reality in which folks just can't pay their rent. And you have folks of color who bought homes. For instance, in my district, we have a large homeownership base, but they bought their homes in the 70s and in the 80s when those homes weren't marketed at $500,000. And so their property taxes are very dependent on their ability to rent out these spaces. And so it's a double, you can't take care of one without taking care of the other. In other words, if there's a foreclosure debt due to the lack of rent, that has to be handled as well. And I think the federal government and the state really have to take a lead on ensuring that we deal with that, because 120,000 households can dramatically reshape the way the city looks, the way it feels, the culture of our neighborhoods. And that's coming down the pike. That's not, next year. That's in months where we can start to see evictions filed again. And that's very distressing. And it's urgent. It has to happen now. And I think it's a conversation that hasn't had the level of interest and need that it requires, because I think that pressure forces solutions. And the reality is we have a lot of folks on the hook, both small business owners who can't make their rents, property owners who can't pay for their properties without those small businesses paying their rents, homeowners who can't pay their mortgages or their property taxes because they're not getting rents, and then there are tenants who can't afford to stay. And so there's this kind of collapsing issue that I think unaddressed is going to really reshape the city, reshape our economics, reshape a number of different things, our schools, all kinds of things in ways that I can't state enough is alarming.
I'd really like to encourage the rest of you to also grapple with and answer that question, or build on or respond to what Ricardo said. Matthew.
Yeah, I might jump in and just do a quick shout out to the staff of the MFA who are going to help all of us get this right. But the thing that I think about is, as a public institution, as a public space, that trust is not given to us, it's earned. And it's a health issue, because when people come back to the MFA, when we reopen, people need to trust and believe that this is a comfortable and safe space for them. So on a health issue, there's an issue of trust. But I think there's also an issue of trust around issues of race and difference, which is, when you come into the space, do you trust that you will be respected, that your point of view will be heard, that you can engage with true freedom with the ideas in the space? And by the way, some of the ideas in the museum are pretty challenging for everybody, which is what it should be: conflict back and forth, raising difficult questions for our society. So do you have the trust that the institution will create that safe space for you around those difficult issues? And I think that that's a big takeaway for me. And I think it's going to become more and more part of the, and I'm saying this positively, the conversation in the culture of the museum. Are we creating that space for those who care about us? By the way, I'm going to say again, I believe we can meet that challenge, but it's at a level that I haven't experienced before.
For me, in the last month, I've been surprised about the pain I've heard from brown and black people. I've talked to people at Cornell, people at Simmons, and throughout the academy and higher ed. And the stories of pain have just surfaced, and people have wanted to tell them. So moving forward, healing is going to be important. But the other thing that's come to my mind, if we're going to have the systems change, we need equity warriors. And this takes all of us to be equity warriors, to think about the systems that we have ownership and agency for and how we change them, to level the playing fields, to have that belonging Matt talked about, to be inclusive that Ricardo talked about. And then on the personal level, America has not liked to talk about race, even in the education system. Race has not been a construct. It's not been a component of the curriculum. And now I think whatever we do, even Helen talked about that when we think about health, race is going to have to be a bigger part of the conversation if we're going to move forward and be a productive society.
Yeah, I agree 100%. And I want to pick up on the trust, because one of the things we're grappling with, that we have to grapple with, is that people have trust that it's safe to get their health care. Many people deferred important health care because of the COVID epidemic and fear. And we're seeing people with advanced cancer and other advanced infections, other things for which they really need care. So we're working very, very hard to reassure everybody that we have safe measures in place to underscore that it's safe to come and get the care you need. On a sort of different but very important note, one of the realities I think that is very, very true that I hope we'll all embrace is the importance of investing in pandemic preparedness. Some of you might have heard that there's a new H1N1 strain of flu that jumped from animals to humans in China. We know there will be another, it's hard enough to believe, but there will be another epidemic. And we need to invest locally, nationally, and internationally to have the infrastructure to prepare for that. And I think that reality now just can't be, we can't forget about it too quickly, right? We have to invest so that we do better the next time.
Helen, I feel like you've started to move us naturally into this last part of our conversation. Remember that the whole focus of this town hall was really to get us to an imagining or a visualization or the imperatives of a post-pandemic Boston and a post-pandemic country. It's almost hard to think that there will be a post-pandemic, especially given what you just said, Helen, which is the possibility of an overlapping next one. But there is a need to move forward, and we know that. And so based on what we just talked about, I think the first question that I would want to ask you there is, what's in your mind the most important next step to get us to a post-pandemic Boston?
Well, I have an answer that is unfortunately simple and probably not what people want to hear. I think the next step is to keep doing the hard work that we're doing. It's to keep focusing on following the measures that are working, the things we can control, like physical distancing, covering our faces when we're within 6 feet of anyone with whom we don't live, avoiding crowds, washing our hands frequently, wiping down those frequently touched surfaces, and really sticking with the program that the governor, I think, is doing a good job in laying out for us. These are the things that we know work. There's so much we know that we don't know about this virus, but we know that these hard measures do work. And I think that is the number 1 through 10 job for us to get to the future and to avoid that shutdown that Ricardo talked about. That would be so painful for us to endure, both emotionally, mental health wise, and financially as a society. So I think that is our number 1 priority.
Lynn, go ahead.
Coupled with Helen said, I really think spending time reflecting upon what we've learned during this pandemic. And one dominant thing is that technology can be good. I think about my own mother, who's 85 now, who feels comfortable doing a telemed appointment, that may not have happened during the pandemic. I think about the way retail has changed. I think about the way Simmons is delivering education in an innovative way, where we're taking technology to another level. So anytime we have a crisis, I'm hoping that leaders in Boston think about what's the opportunity. So when we come out of this pandemic, when Helen and her colleagues get that magical vaccine, that we really will take forward the good things that have happened during the pandemic and make the world a better place. That I'm trying to be optimistic in this time. And the way we've used technology, think about how comfortable people are with Zoom now. One of the things that's come out is that we all realize we don't have to be in the office 40 hours a week. We can get a lot of work done at home. And so there are a lot of efficiencies, opportunities, even the way we think about government. I'm optimistic maybe that I can not spend days at the DMV when I need my license renewed or something. And so using technology as an enhancer will be really important.
So maybe I might just say something about that, which is, a friend of mine, I was bemoaning with a friend, we have to learn how to connect again. And he challenged that. And he said, no, we're actually more connected, right? What the president's saying, that notion of actually connecting through technology. And I think that if something's going to stay behind for me, it's that notion that we have to stay in that place of connecting unexpectedly. And, the virus is, for me, the great symbol of connectedness because it has no boundaries, it's invisible, and it connects all of us because we're all equally vulnerable, more or less. I get the race disparity, but we're all vulnerable. We're all vulnerable. And so that notion of connectedness, and I'm looking at the screen and I'm thinking, well, I'm with, 3 colleagues, with you. We're in a conversation I wouldn't otherwise be in across disciplines. We have to remember that challenging times need diverse points of view. And if we can figure out how to maintain these systems of connectedness, we can make some big breakthroughs. I really believe that.
I think for me, it's tackling hard things. When we talk about addressing racial inequity in the city, right, that's going to require an intentionality that can be very hard. I think the reality is, for many people, the idea of addressing inequity is misconstrued with the idea that that means less access to things for you rather than equal access to those kinds of resources and opportunities to communities that otherwise have been shut out. And I think the reality is that creates, from a political standpoint, a pushback whenever we're trying to intentionally address this harm, the harm that has led to lack of opportunities or lack of resources, because that requires providing more resources and more opportunities. And I think when we talk about moving forward, it's going to require us to really, and I mean this from a personal standpoint, I mean this specifically from a personal standpoint, if you are doing something to address racial inequity or social inequity, and it's easy for you to do it, if you say that's an easy thing for me to do, then you need to dig deeper and find that harder thing to do. So for instance, if we're talking about it's easier for me to address the symptoms of racism than the systems themselves, then you should also address the system and those symptoms. You should dig deeper. And I think that that's a harder conversation, but one that in this time, talking about something that's been different, and I know Dr. Wooten mentioned this, people have brought up their pain a lot easier. I've done it. I've been swimming in and out of trauma and secondary trauma as I navigate these things, to be quite honest. At the State House speech, that was a very emotional day for me. And there's been aspects of this that have carried with me. And I've labeled it like this. We can have policy disagreements, but when we talk about race, we're talking about my life. We're talking about the lives of my family members, the life of my nephews, the life of my future children, the life of my parents. And there's no real issue that anybody can bring up, whether it's environment or gun rights or housing, that we don't have faith can be solved within our lifetimes. I have a history of seeing race inequity not solved in people who I've loved's lifetimes. And there's a level of distress that I think every person of color carries, understanding that they can put everything that they can muster of themselves into the fight for racial equity. And when they die, we may very well not have moved that much further than when we began. And the only way that that's going to get reversed is if folks in power, our white allies, our white accomplices, folks who have access to these systems, begin to do that hard work themselves. And I'll give one small example so I don't dominate time. Many people have said in this time that they're going to do more. And they've said it, some of them reassuringly, some of them as a way of acknowledging that they haven't been doing enough. And I think it's really important to understand that if you're in a position where you can say you can do more, then do that more. Because if we were talking about, say, a lifeguard who happened to see many, many people drowning in a pool, and at the end of that said, you know, I could have probably swam harder. we're all going to have an issue with that. And so it's really about digging deeper, making sure that you're doing the hard things, because I think that that same pressure that every person of color carries to reverse these systems has to be mirrored by other folks who otherwise aren't directly impacted in the same ways. And I'm confident that in this time frame, I've never seen more attention paid to it by allies and accomplices, more listening. That's certainly something that I've actually witnessed. And so I have hope.
Thank you to all of you for your answers to that question and for those notes of hope. We have about 10 minutes left, a little bit less, and I want to invite a little bit of imagining. Okay, actually, I lied. I want to take one more question, and then I'm going to invite a little bit of imagining. But I think this question is so important to our ability to get to the post-pandemic world. So, Helen, I think this is another one for you. Shoot, I lost it. I had it on my screen and I lost it. So I apologize. I'll pull up the question asker's name in a minute when I find the question again. But the gist of it was, oh, here it is. Regina, the second wave has already begun in some states. How do we insulate ourselves in Boston, especially communities of color, but all of us, in order to avoid a second wave so that we can, in fact, begin this journey towards hope and towards the future that we're talking about?
Yeah, so great question. And I think, the sad truth is that we're still in the first wave. So many places in the country are still suffering from the first wave, and they're seeing their big increase. And that, of course, is a concern. And we don't fully know how this virus will behave. And I think that can't be stressed enough. What can we do? We can do the hard work, and I'm going to sound like a broken record, but the things we can control are our behavior, covering our face, keeping the physical distance, avoiding crowds, really paying attention to hand washing, wiping down those frequently touched surfaces. These are the things we can control, and really following the governor's lead on the reopening. These are the things that will keep us safe and give us the best shot at not having another big surge too soon.
Thank you for that. And so in our last few minutes, I think what I would ask each of you is to try to imagine maybe a year from now. Hopefully, and I understand I could be being naive, hopefully we have a vaccine, we have a solid set of treatments. We've gotten to phase 4 here in the Commonwealth and to a stable place as a country. What's one thing that you will be doing dramatically differently in your field or in your work that you're so excited about? I know it's a hard question.
Well, I can take a stab and come back to something that Lynn said earlier. For us, I think one thing is telehealth. So we have seen the advancement of telehealth probably a decade in 6 months, right? We were talking about it, we were getting into it slowly, but telehealth is a real part of healthcare. And I think it's here to stay. How much? I'm not sure. But for people like Lynn's mom, who's comfortable doing telehealth, that is potentially keeping her safe and getting her care that she needs. And we have many such patients. So I am excited about that because the feedback we're seeing from patients on their satisfaction are extremely positive. So this is one silver lining of this deep cloud that we've been living in. And I think it's another tool we can use with technology to the betterment of health. It's certainly not the answer, but it's one positive step.
I might just say something a bit self-centeredly about the museum. I think in a year's time, we're going to be a better place to work. I think we're going to get rid of some of our processes. We're going to have more work from home. We're going to be more thoughtful about maternity and paternity and the balance of life. Not everyone's going to be commuting every day. I mean, I think we're actually going to simplify some things. And the great thing about that is we'll be able to communicate better. And, we're going to be in a different place around diversity in a year. I'm sure of it. Is it going to be fast enough? Is it going to be bold enough? I'll be in that conversation, but we're going to be a more open institution and we're going to be a better place to be. And that's going to come out in how we greet our visitors. I think that there's a lot that we're learning now about how we purposely layer and complicate things, how our decision making isn't as agile as it should be. how it isn't distributed enough. And I think we're going to learn some really good things in a lot of the processes we're going through now, and we're going to come out a better place.
For me, I think, and it's particularly Simmons, what I'm excited about is the potential to deliver education across the world. You know, Simmons was founded with the mission of economic empowerment of women, and we're thinking a lot about online degree completion programs. Women tend to be a dominant population who start their degrees and for a variety of reasons do not finish it. And we know that in America, education is the one thing that levels the playing field. And so this online degree completion, especially for essential workers, such as nurses and social workers, what I'm really excited about expanding that.
I think for me as an elected official, we do so much of the work that any elected official does is geared and guided by external pressure. It's by direct action. It's by what, you know, the people actually want. There's a people power to that. And a part of that is breaking down and simplifying things to the most basic level so that we can make sure that the most amount of folks understand. And for me, in a year, I've already been surprised at how quickly folks have picked up the idea of systemic cures for systemic problems, how quickly they've understood, you know, that's not that, how quickly they've gone from that's a solution, but it's not necessarily this solution. And that's the kind of stuff that in a year, when we're trying to do really hard work to reverse, you know, centuries and centuries of inequities in all of our systems, that work that is being done now, that understanding that is being done now is going to be invaluable when we're actually making those fights, because more folks are going to know why that fight needs to happen, why and how that fight benefits their lives, and why and how those changes are necessary. And so, you know, for me in a year, I'm already astounded within the last 3 months of the progress we've made just as a city, as a country, in understanding our roles and responsibilities in these outcomes, that these aren't just things that happen. They're not personal failings. They're systemic in their processes that create these things. And so in a year, I can see that paying off in major reforms and in major ways for pretty much, you know, everybody in the city of Boston, but hopefully more universally in our state and in our country.
So there is so much more we can talk about. I didn't even get to ask Helen if a year is an appropriate time frame to be dreaming about or not. I see a little nod there. I'm going to take it as a yes. You can't take it back. I'm going to take a year as a yes. I want to thank our audience this evening, and I really want to thank our guests, Lynn Perry Wooten, who tomorrow becomes president of Simmons University. Lynn, thanks for being here with us. I really appreciate it. Actually, I'm going to have you all come off mute so you can say you're welcome.
Thank you. And, you know, my tagline has been keep hope alive during this pandemic.
Matthew Teitelbaum, director of the Museum of Fine Arts, Boston. Matthew, thanks for being with us and part of the conversation.
I'm glad to be here, and I want everyone to know that the Museum of Fine Arts belongs to you.
Dr. Helen Boucher, Chief of the Division of Geographic Medicine and Infectious Diseases at Tufts Medical Center. Helen, always great to have you.
Thank you so much for having me, and just want to encourage everybody to come back and get the care that they need, because you're safe with us and we're here for you.
And Ricardo Arroyo, Boston City Councilor from District 5. How great to have you with us tonight. Thank you.
Thank you, all of you, for the work that you do. We're all interconnected. My constituents are all interconnected with all the work you do. And so thank you so much, everyone. That includes you for hosting these kinds of conversations and making sure we do that kind of information sharing. So thank you, everybody, for what you bring.
Thank you. And to all who watched and participated tonight, thank you. And thanks again to everyone who's tuned in over the last few months to help these WBUR virtual town hall events be what they are. Your questions and your participation have been integral to their success. In the midst of turbulent times, it is so important for WBUR to maintain this venue for live interactive discussion, especially when we can't meet in person at WBUR's live event space, CitySpace. I do hope you'll stay in touch with us about what we're doing next. You can sign up for the CitySpace newsletter at wbur.org/events. I want to thank you all again. I'm Tiziana Dearing. Stay well. And hey, why not tune in tomorrow for Radio Boston at 3.